Hey guys, welcome to another episode of Civilian Medical Podcast. Man, we're two in a row now. Pretty excited about that. We're on a winning streak here. This is episode 62. We're going to talk about cold weather issues, injuries, and some gear that you should be carrying in cold weather environments. So, my name's Dietrich, Skinny Medic on YouTube, Dad Bod Medic on Instagram. I have my co-host.
I'm
I guess
Sam on Prep Medic.
you're Robin. Like I'm Batman, you're Robin.
I don't think that's the case, man. I don't think
That's
so.
That's what we should get our logo made up as for our hoodies. That would be awesome. Like, I think I have a picture already. Like, I could do me as Batman, you as Robin. We'll put Sean as a Joker, like in the background somewhere, like fading off into the background. And that would be a great logo for us.
Isn't Sean more of the Penguin?
Oh, that is a great one. Yeah. I'm going to email my graphics guy right now. Like, we're going to get this going. Like, this is going to be limited edition t-shirt, Civilian Medical Podcast. That'd be awesome. All fundraisers go to Sam to feed his baby.
Let's do it.
Or diapers. Yeah, more like diapers probably.
Yeah, at this point, yeah.
So baby's swaddling? I saw you're trying to get him out of swaddling? Like, you're not intending to man up and, like, just grow up?
We're trying to get him out of swaddles, man. And this is our first weaning process of anything we're doing. And what I've learned is that I'm a coward.
Yep.
That's what I learned. It's like, oh, it's not working. All right, back to the swaddle.
Yeah, just cry for 2 minutes. Like, all right, I can't do this anymore.
Exactly.
That's funny. Well, this episode is sponsored by Primary Arms, which super excited to have them as a sponsor. And since we were talking about cold weather injuries and things like that, I looked up their gear, like clothes-wise, and they have some really cool jackets by a lot of name brand companies like True Spec and 511. Coats that I like wearing that don't look super tactical but can keep you warm because I don't like being cold.
Couple pockets never hurt anybody. I like having something a little bit warmer with a little bit more carrying capacity in it. And people in the know.
Yeah, like I want to be warm, but I don't want you to like I've got a couple jackets that I wear like at work that have patches on them, things like that. But if I'm at Walmart with my kids, I probably just want to blend in and not get recognized. or not say, hey, that guy looks super tactical with his Solomon shoes and his 511 jacket. So um, I went to Palmetto State Armory and was disappointed that I didn't get recognized. Like it hurt my feelings.
Yeah, that's just, it sucks. Maybe if you get a couple more subscribers on YouTube, that'll help you.
If I was at like 270, 280, something like that, I probably could get recognized. But yeah, like the last 2 times I went to PSA, I got recognized. And this time me and my son went in and he's like, you gonna get recognized? I was like, I don't know. We'll see. Walked around, not a soul. I was like, oh, I'm fading off into the distance. I'm done. So cold weather. I'm in South Carolina, so our cold weather is like 30 degrees. That's when it's 32 out there right now, and like I was like, I don't want to go outside. It's freezing cold. You're in Colorado, which is a little bit different scenario.
Yeah, in Colorado now, Front Range isn't too bad, but you get up into the mountains and you get pretty austere conditions pretty quickly. And then I was born and raised in the Midwest, so that's just humid, tons of snow, and -30. So, up in Wisconsin. So cold weather gear really is important, and kind of changing your gear out for the winter months, I think, is also a really important thing because you kind of have a whole nother set of things to worry about. And those freezing temperatures can both cause issues that you have to treat, and then they just make everything else a lot worse. Any kind of injury, medical issue, it's just not good to be cold. So you really have to take that into account with some of your preparedness, in my opinion.
Definitely. I think even for like the responder, like civilian responder, like you have to think about layers because, for me, like I can dress super warm, but then we start hiking or do something like that. You start moving layers. You don't want to get too many layers taken off, but at the same time, like the ability to be flexible with your layers, your clothing is important. And this is where I don't think we should skimp on stuff, because you're going hiking, you're going to be outdoors, you're hunting, fishing, skiing. Like I don't think you should skimp if you can afford it on your gear that you're actually wearing, because now you're getting wet and you're getting cold. Like that's not fun. And like you said, even the smallest things get complicated when it's cold weather. So I don't think you should really skip here on your warm weather gear.
Yeah, I think there was a story not too long ago in the news, and I can't remember if this was in my state in Colorado or if this was nearby, But I thought it was I-70 got shut down and people were stranded overnight in the mountains for like it was something like 27 hours or something like that. And who knows how much gas you have in your car, what you're prepared for. Same with hiking, is you might prepare for a hour hike. Something happens, act of God happens, and you end up out there for, even 3 or 4 can make a huge difference. So, definitely having a little bit more than you think you need is important, especially now with, cold weather gear isn't as heavy and bulky as it used to be. And then first aid items, when we're talking like IFAKs and stuff, you can really easily fit some things that are going to make a huge difference in a pretty small pack.
Definitely. So like in my truck, I carry a wool blanket, typically always just to have it in there. And then fire ways is different, couple different ways to start fire because no my luck, the matches aren't going to work. The lighter's going to be out of butane or something like that. So a couple of ways to start fire. I've actually started a fire on a call, which is kind of fun. We spent a few hours in the middle of the night on a side of waterfall and we got super cold. So we're like, hey, while we're waiting on this helicopter, we're going to start a fire. So we kind of gathered up some fire and it was kind of fun. But staying warm is important to me. I don't like being cold. I get super grumpy. So having extra gear, ways to stay warm, even for me, the provider, is important.
So I like the first thing you said. You talked about having a wool blanket, and that seems like a good place to start when we're talking about, gear and all of this. If you're looking for any kind of material, like material matters. We've all heard cotton kills, and I'm guessing most of the listeners here are pretty aware. But some aren't. And wool, in my opinion, is kind of king. It's the best material you can have in the wilderness because it still insulates when it's wet. Cotton insulates when it's dry. There's a ton of stuff that insulates fine when it's dry, but the second it gets wet, you lose all of the advantages of it, and it's actually going to make things a lot worse. So, having a wool blanket on, especially hunters, hunting with wool clothes, I think First Light makes really good wool stuff. You have Smart Wool in the hiking realm, but really having some of those wool base layers, anything like that is I think kind of the staple of warm weather gear when it comes to survival situations.
Definitely. So I found a couple of articles about injuries that we kind of see, common injuries. And I think this is a good talking point for both of us, kind of some injuries we saw. And so we can kind of go through that and see, what type of injuries we're going to see and then how to treat those type of injuries and then what kind of gear would be super helpful. Maybe we can kind of throw in there like, hey, if somebody's on a budget, this is kind of what you're on. Or if, hey, no one has a budget, like money is no object, then this is what I would go for. So I think that's kind of cool to kind of go through that for next little bit.
Absolutely. So we want to start with probably hypothermia because that's kind of the most systemic. I would say looking at it. So you've got kind of 3 phases of hypothermia, and Dietrich, correct me if I'm wrong or if you disagree, but the phases of hypothermia I don't think are super important for people to know. But you have mild hypothermia, which is a body temperature of 98.6 to 96 degrees Fahrenheit, moderate hypothermia 95 to 93, and then severe hypothermia is basically 92 degrees. And below, and then you have like some like irreversible, like you're not going to live if you get down to a certain point. But I think the nuance of that doesn't matter, but the concept does. So do you see a lot of people with hypothermia, and what do you usually do about it?
So we do. We see a lot of like hikers kind of in our that weren't dressed accordingly. So we'll see them, that starts to get around sunset and like, oh gosh, they're still an hour from the base camp and they start to freak out. So they don't have ways to start fires. They don't have a shelter, things like that. So they do call us. Typically it's not anything major, but they do see that like, they're starting to shiver, that mild hypothermia where they just think they can't walk anymore because of they're just so cold. So we carry a couple different things for us is we carry the blizzard blankets, the mylar blankets, things like that. And we carry hot packs because my team is super small. We don't have a huge budget. So we can pop hot packs and with a survival blanket. On the EMS side, we do have, my department has 2 of the NAR fluid warmers. So we can give the patient warm fluid, which has been helpful in the past. So normally, like on the EMS realm, we talk about saline is not good, how saline is pasta water. But for this scenario, it does work. I think I can talk about this call without getting in trouble. If I do, we'll figure it out. We had a diver. We had a rescue diver last year, maybe, that was diving in water. Probably, I want to say the water was 56 degrees, just kind of shooting out the cuff. But it was cold water, and his dry suit got a hole in it. And he come up. He was down at the bottom, came up, and his dry suit's completely wet. And so we'd already knew he was in trouble. So I met him at the bank, and I was like, "Hey, bud, you okay?" He's like, "Yeah, I'm okay." And he's like shaking violently, like he can't control himself from shaking. And he's a former paramedic, but he wasn't super thinking clear. He's like, "Dietrich, I'm fine, I'm fine." And I was like, "You're not. Like you can see, you can barely walk. You're shaking so bad." So we got him in the truck, got his dry suit off, got dry clothes on him, and started drying him off, getting hot packs on groin, axillaries, armpits, things like that, covering him up with tons of blankets around his head too, and then started the fluid warmer. And by the time we got probably about 250 cc's of warm fluid into him, he had stopped shivering and was okay. So we went from violently shaking to can barely walk to in the ambulance, not shaking anymore in about 5 or 6 minutes. So it made a big deal getting those wet clothes off and getting him. It's kind of not fun getting undressed in the cold to get those wet clothes off, but it is what needs to happen.
Yeah. And like with that, so you talked about some of the symptoms he was kind of showing for it. Most people listening have probably experienced mild hypothermia at some point in their life. It's not too uncommon. You go out, you get super cold skiing or something, you're going to experience mild hypothermia, where you have just some peripheral vasoconstriction. Your body's trying to shunt some of the blood into your major organs. You have some shivering that's not under voluntary control, but it's not super bad. Then when we move into that moderate one, which it kind of sounds like this guy was in, you get kind of a dazed consciousness. So they're, alert oriented. They'll talk to you, but a lot of times it's like violent shivering. They can have some slurred speech. They're thinking, but they're not thinking necessarily as clear as you might see, and kind of have this flattened affect because they're putting in so much effort into, just getting warm, and it's not fun. And their body's kind of in this, we need to get warm right now. So it sounds like that's what that guy was in. Do you agree?
I agree with that.
And then the other thing to think about, though, is you got him to stop shivering. And obviously, he's improving because you're in a warmer environment, but you have severe hypothermia. And a lot of times you look at somebody like initially in severe hypothermia, you're like, oh, no, they're not hypothermic until you really get up to them because they don't shiver. That shivering reflex will actually, stop when we start dropping below that 92-degree mark. And that's really when things can get really, really bad for people. Because shivering is a way of generating heat. That's why your body is trying to build it up. And you get a lot of lactic acid is building up in the skin. You've got shunting into your vital organs. And even to a point where if you jostle somebody too hard in severe hypothermia, they go into cardiac arrest. They'll go into a severe cardiac arrhythmia, just because they're so tenuous. So just because somebody's not shivering doesn't mean they're not severely hypothermic.
Right. So for our listeners, probably not going to check a temperature on our friend that's getting hypothermic. Like, I don't think that I carry a thermometer in my kit. I don't know, you may, but I don't carry a thermometer. So for me, mental status, like you said, that are they shivering, not shivering? How violent is the shivering? And then their mental status is what I'm going to kind of rely on to kind of categorize them for their hypothermia.
Yeah, absolutely. And, even if you do carry a thermometer, really the only accurate temperature when it comes to this kind of hypothermia, when we're talking about these extremes and out there, is going to be a rectal temp. And I'm guessing not a whole lot of people are going to want to grab a rectal temp on their buddy
No, he's got to
out
take me to
there.
dinner first.
Exactly. So, with that, unless you really want to humiliate somebody, or if you're in the military, I hear that's kind of the standard of care there. So, with that, you probably aren't going to get it, but I don't think it's really that important to get a core temp on somebody. As long as you're looking at them, like what physiologic signs they're showing, you should be good to go. One thing with these kind of these three phases, like we're talking about hypothermia as if it's the primary problem for a patient. But let's say, you're driving along on the highway, it's an icy day, it's cold out, and, somebody crashes. And now they're, out. Maybe you applied one of your tourniquets or something from your civilian medical trauma kit.
God, I got you trained well there.
Yeah, right. You like that plug? I'll take 50%.
Yes.
So with that, now they're outside, they're cold. When somebody has a severe traumatic insult, they can become poikilothermic, which is basically their body lacks the compensatory mechanisms to warm themselves back up. Where you and I might be okay out there, they're not going to be. And they're going to start taking on the temperature of their surroundings. So coagulopathy, which is basically your blood's inability to clot effectively, starts
Can
at
you
about
spell that?
I can't spell anything. With that, they're going to start being able to clot. So even on, like, let's say it's a 94-degree day, you feel like it's really hot, you're not thinking about hypothermia, or you're not thinking about temperature issues, and somebody's just had this massive trauma, they're still going to take on the temperature of the ambient air because their body can't compensate. So you can have hypothermic patients or patients that are not clotting well in really, really warm days. So we need to make sure we're prioritizing, that heat loss, keeping that heat loss from happening on our trauma patients, even on hot days. And it just seems so counterintuitive. I've forgotten it on calls. I don't know if you have, but it is something that's really important.
Definitely. I forget the percentage of like our local trauma center talks about how trauma patients come in hypothermic, and this is middle of summertime and they're hypothermic from EMS because we turn the AC on. I like keeping blankets on the stretcher, and I've done it plenty of times. Show up as a quick response vehicle and like start throwing blankets on, and the crew, the fire department's pulling blankets back off. I'm like, no, like I'm trying to tuck the blankets back on. But thinking about the March algorithm, people they'll spend good money on combat gauze, cat tourniquet, hyphen chest seals, and then like, oh, hypothermia, I'll throw the 99 cents Mylar blanket in there. So I definitely think, obviously the Mylar blanket is something that's, if it's all you have, it is, but it's easier to prevent hypothermia than it is to try to fix it. So by the time the patient starts getting hypothermic, we're already behind the game. So if we can keep them from getting hypothermic, then it's going to help us in the long run.
Yeah. What do you so like I have the Ready Heat blanket. I think the company is Ready Heat, and it's like a bunch of hot packs in a person-shaped cocoon that you can basically throw somebody in, and it won't burn them. And then I'll take like blankets, try to wrap that if I have them, and then if I have a Mylar blanket, we're outside, I'll cocoon them in the Mylar blanket just to keep some of that radiant heat in. What do you use something specific when you're like in your professional role?
So we kind of do this. We make our own basically is what we have. Like we have extra hot packs on the truck, and we have the blizzard blankets that are the big, huge double layer. I think they're double layer Mylar blankets, so we can cocoon them, wrap them up, things like that. So we're kind of making that system, but using instant hot packs, things like that. So what's the price on the ready kit? Do you know by chance?
I don't know. I don't think it's that expensive. It's less than $100, which, like, for a lot of people that's still a lot. But if you just have like heat packs or those hand warmers, you can just use those kind of like you guys do. Have like a big packet of those hand warmers, open them up and throw them in like at major pulse points. So, if you have them, try not to get them directly on skin, but if you have them like at the neck, groin, armpit, and you just put those on them, then wrap them up. I think that's a pretty viable option. What it for somebody that's just using, like, they have that 99 cents Mylar blanket, which is better than nothing. Like, how do you make that effective? What do you have to like add to that to actually make that an effective tool?
So the problem is like you've got a patient laying on the ground. So you got to actually get them separated from the ground because, like you saying, like even 94 degrees, someone's laying on the grass. Like just because the wind's blowing, they're already cool, pale, diaphoretic. Like so, getting them separated from the ground, if I found is easier. Trying to get them up off of it. If you have two of them, makes it really nice because then you can put a layer on the ground and then cover them on top with another one, and then keeping the head covered is important because we're losing a lot of heat from the head. So um, it's really nice to have two of them, but that's kind of how we're using it. I did look up on NAR. Their hypothermia prevention kit is 108 retail. So if
And
you know,
the but the Ready Heat blanket's only 40, it looks like.
Oh, really? Okay.
Yeah, so if you just get the ready heat blanket, which is honestly all I do, it's a lot cheaper.
So I think something like that for like somebody who's out hiking, that's hunting a good bit in the wintertime, like $40 on a blanket to make sure you're not cold if something bad happens is not unreasonable. Something to think about.
Yeah, absolutely. So I think that's the big thing with hypothermia, just, preventing it, recognizing that it can progress into like kind of it doesn't look always like we expect somebody cold to look. We expect them to be shivering, but it can definitely progress past that. We definitely have to be really careful with patients that have trauma associated with it. What's kind of the next? What's the next condition we're talking about?
I was going to ask you one question real quick.
Oh yeah.
What's your thought on like having patients drink hot coffee and stuff like that?
So I guess for me, it depends drinking because if somebody's not injured and hypothermia is their main thing, like, when I was on ski patrol, we'd pull people off the hill all the time. And they would, be mildly hypothermic. And it was just a beginner that got stuck up on the top of the hill for a while or, whatever. They weren't hurt. We'd take them in the patrol room. We'd give them coffee, put some blankets around them. It would be okay. Coffee, for one, can be kind of harmful with caffeine in it because it does promote vasoconstriction. So it reduces the amount of peripheral blood flow you have and can actually make the condition slightly worse. Um, Realistically, if they're in a warm environment and they're not going to get cold again, not a big deal. In my opinion, I think they'll be fine. Hot chocolate's probably the better bet there, just because there's no caffeine. It doesn't cause that vasoconstriction. It's still warm fluid, so you get that core warming. Um, as far as if somebody's injured and you're giving them those things, I wouldn't personally, because they're going to go into surgery. Potentially, they have a long road to recovery. They might have to receive an airway later on. And having anything in the stomach, the more separation we can get from them eating or drinking something and having that procedure happen it's safer for them. So they don't, lose consciousness and aspirate. Now we've got aspiration pneumonia on top of that, makes the tube hard to get. So, you know, use your judgment. But I personally wouldn't. Now, in an austere environment where you're trying to keep people alive, it's going to be a long time till help gets there, and you have the immediate issue of hypothermia. In my opinion, sure, go ahead, try to get that core warm. Give them something to warm them from the inside out. You have in the ER when somebody comes in with like really severe hypothermia, they'll do. Have you seen gastric lavage performed
I have.
with hot water? So they put a tube down into the stomach and they pump water into it, warm water into it, and then they suck it out and they keep on doing that, and it helps warm your core. So it's kind of the same concept with hot chocolate and coffee.
Awesome. Yeah, we're on the same page with that. Like I said, if I feel like if I can get the patient into a warm building, warm ambulance, if they want a cup of coffee, it makes them feel a little bit better. They're probably not going to drink much of it anyway because they're shaking so bad. But at least makes them feel better. So I'm okay with it. Like I said, just be careful because the caffeine, increased heart rate, vasoconstriction, things like that. So just be cautious about it. So the next injury we can talk about is frostbite. And be honest with you, I don't think I've ever treated anybody with frostbite.
We saw it a lot on ski patrol. Just because like once again, frostbite's something that you've probably seen. You take off your ski boot and you've got kind of white, waxy toes for a little bit. That's frostbite. That's super mild frostbite. And it can get worse. I know I've had and seen some patients with your blistering frostbite where it's almost like a burn. And then you have like your severe frostbite. It's like your third and fourth degree frostbite. I've seen that more in the critical care realm, transporting from facilities. So for me, I think of frostbite kind of like a burn. It's treated the same way. Severe frostbite is still treated in burn centers because really a lot of the skin breakdown is almost identical and it has degrees. So you've got your mild, your first degree frostbite. And basically it's characterized by some itching, maybe a little bit of swelling in the hands or feet. Frostbite's most common on extremities and things that stick out of your body. So your nose, your fingers, your toes, anything like that. Especially skiing where you have tight boots on, it cuts down blood flow and it can happen pretty easily. But for first degree, you don't have any blistering or peeling. Generally, do you have any tricks for treating this, Dietrich?
We were just taught basically to warm it up gently, like don't just go from freezing cold to boiling water super quick. So we were told basically to kind of gently warm them up, not to rub on the extremity. Try to warm. Don't rub on the fingers. Don't rub on the arms, the toes, things like that. I don't like toes anyway. So, but not to kind of do as a gradual. And then if we thought that it may refreeze again, like before we get the patient to definitive care, not to even try to rewarm it.
Yeah. Yeah, absolutely. And the mild frostbite, like I guess I completely agree with you, and that's exactly what I was taught. Is that we're not really going to be aggressive with it. We're kind of going to let it ride and warm it up ambiently. We might do some warm water, but honestly, I don't usually. I would just put it in a warm environment, promote blood flow, and go from there.
Because generally
Um,
having hot water is the issue. Like on the side of a trail, we're not going to be able to, because you have decently warm water, lukewarm water, and you put a cold extremity into it, it starts cooling off pretty quick. So then you have to rewarm the water. So you're not side of a trail, side of the road. That's not really very feasible.
and you're making them wet. So the second they take it off and that water cools down, and now they're wet and they're losing a lot of that heat that they already had, so you can actually make it worse. So I personally kind of avoid water in any kind of pre-hospital frostbite. It's not something I've ever done or really plan on doing there. So your your second degree and third degree frostbite, your second degree is going to be blistering. So if you ever burned yourself on the stove, you get that blister forming. It can be very similar in this frostbite. A lot of times it can make your fingers look like ET because it'll affect the tips of them sooner. And then your third degree is the initial phases of necrosis of the skin. So your skin starts dying, and some of your subcutaneous tissue, so the tissue directly under your skin, starts to ulcerate. And this is really where I've been, once again, we're not doing aggressive treatments for it. But one huge danger when it comes to this frostbite getting a little bit worse is you basically have frozen extremities. And if you start like rubbing that, you have ice crystals that have formed in that subcutaneous space. And you can actually cause a lot of tissue damage by rubbing or moving around that extremity too much before you warm it. And yeah, so we've always been taught kind of let it be, but warm it up.
Yep.
The other thing with that is not letting it refreeze, like you said. That the thawing refreeze can cause a ton of issues down the road. So I believe when I went through school, we don't see a ton of frostbite, like you said, but they said that it's better to just leave that frostbite frozen than it is if you think it's going to get refrozen than it is to thaw it out there and then have it refreeze. So if you can't guarantee that extremity is going to be safe for the rest of the call or your exposure to them, don't even try to treat it at that point. Try to minimize any more cold exposure, but don't rewarm it.
Definitely. So kind of equipment wise, like same thing we talked about hypothermia, some warm packs might be the hand warmers. Um, what do you think about like any like splinting it, kind of like treating it like a fracture?
Yeah, I like that. That's honestly something that I haven't thought about when I've been exposed to it. But I think that makes a lot of sense to keep that movement down. Splitting it, just kind of keeping it from moving too much. Just thinking off the cusp here, if it's just a hand, you could almost wrap their hand around a piece of gauze or something and then put a mitten over it to kind of hold everything in place, keep it from moving too much. You can wrap it if you want, but just keeping it from moving too much in that moment, and then kind of prepping the patient because once that starts to rewarm, it's going to hurt quite a bit.
Definitely. Like that doesn't sound like fun. Like I said, I probably have no, I probably have seen some mild. I just don't know. We've never been called like, oh, this is frostbite. Like it was like a diagnosis, like, oh yeah, I know this one. But so, like I said, we don't really deal with super cold temperatures here, but definitely something that we could see.
Yeah, it's kind of funny. Coming out of paramedic school and stuff and doing it professionally is there's a lot of minor things that I feel like I don't know how to do. Like people are like, oh, like you must know exactly how to clean out all these wounds and whatever. And like you're not taught how to deal with, a tiny cut in paramedic school and stuff. So obviously I've furthered my education, a lot of the minor things, but you kind of come out of school and there's like things that you're just not called for that you don't get any exposure to, and you just don't really treat
Mm,
that somebody on a ski hill probably treats way more.
yes, like I love teaching. Like I teach EMT class 1 to 2 times a week right now, and I teach the sling and swath. And like I love teaching that because I'm like, hey, the next time you're on a call, like I bet the paramedic doesn't know how to tie this correctly,
Nope.
because we have forgotten that so long ago. We're like, which way does triangle go? So I love teaching my EMT students how to do stuff like that. And I'm like, hey, look, you're absolutely going to save your paramedic's tail by doing this, because they're not even going to remember how to do this, and they're going to look like a complete idiot. And so you can be like, hey, I got that for you. Go get the stretcher. And you can tell your paramedic partner, go get the stretcher, and you're going to tie this for them. So I like doing stuff like that. It's fun. So definitely our EMTs save our tails all the time.
Paramedics just know how to splint with fentanyl.
Yes. Ketamine. Oh, you can't give ketamine. Oh.
Hey, no, we can. We can for pain. We can for
Oh.
pain, but a certain department may have ruined it for the rest of the indications for ketamine.
Okay.
Yeah,
Mm.
don't rub that in. That's a
Yeah.
sore subject.
Man, like I'm too old to fight now. So like if dude wants to fight, some ketamine.
Have you
I
ever been
will.
able to fight?
Yeah. Man, I loved to fight when I was younger.
I don't believe you.
Yeah, I did. I was skinny. I was like 100 pounds. So I had to fight. I was
Comment
like,
below if you want to see a prep medic skinny medic boxing match.
I was gonna do it. What, like 2 years ago? I flew all the way out to Colorado to fight you, and suddenly you were busy. You had to go take care of some wildfires that were trying to burn down the state. But yeah, I flew across the country to fight you, and you bailed on me.
That's a story you keep telling yourself.
It's my show, buddy. All
Pretty
right.
soon you'll just put your son in for a stand-in, and then that's what we'll do. But he'll
Yes,
kick my ass.
he's probably gonna be smarter than me, so he'll definitely. So, yeah, he's talking about taking jujitsu. I'm like, yeah, that'd be awesome. I'm like, oh my gosh, like he's already got his black belt in Taekwondo.
Oh, that's
He's
awesome.
working on another Okinawa. I can't remember. But another, and now he wants to do jujitsu. I'm like, oh my gosh, he's going to kick my tail one day. And
Yeah,
I can't wait to that.
Think.
Yes, that's what I keep telling him. I was like, I can't wait to that first day where you think you can. I was like, that's when it's going to be fun. I was like, after that, probably not so much.
So cool. So we haven't talked about 4th degree frostbite yet.
Okay.
And that's like necrotic fingers that like it looks like honestly it looks like a 4th degree burn where it's down as deconstruction of connective tissue and bone, and it basically is blackened fingers. It's just bad news. And this is, where you lose your nose, lose your fingers, lose your toes. I've never seen this in the pre-hospital environment. We've flown to this a couple times, and really the treatment for it is limited. So they can give like TPA, which is a clot busting drug that's usually used for strokes. That's sometimes used in these to help promote blood flow. Leeches are sometimes used in the hospital to help promote blood flow, which I had no idea that was still a treatment. But a lot of times there's not a whole lot we can do in the pre-hospital environment. I think splinting, protecting that extremity, and just preventing it from freezing any further is the key. Do you have any little pearls?
No, I was just kind of thinking about like it looks like, since you're gonna have nerve endings, things like that damage, that probably the actual part of it that is the 4th degree is not gonna hurt, kind of like a burn, but everywhere on the edges is probably gonna be super painful. So I think about that. Like the actual fingers probably looks really nasty, it looks really gross, but it's probably not super painful except around the edges where I'm sure it does hurt, but it's kind of like I would think of like a 4th degree burn.
Yeah. Well, and I think that's why it gets to this point for a lot of people, because this isn't always somebody that just got stuck in the wilderness. On our elk hunt this year, they were telling us a story of somebody that rode out and had this when they got out, and they didn't even realize it because it got cold. Then they stopped feeling it. They were like, oh, no, I'm cool. I can't feel my toe, but it's better than it hurting. And they came out and ended up losing a toe or two. So with that, if you're with somebody like this, just protect it, that extremity, make sure people know what's going on, and just be really careful with it. I don't really have anything else in my practice that I'd be doing for it other than just trying to protect it from the elements.
Yeah, I think I'd be, somebody's got history of like heart conditions, diabetes, cholesterol. Like I think that's all gonna play into how effective they are to this. So just be cautious.
Yeah, absolutely. And I mean, that's a good point. Somebody with comorbidities, like all of those things you just mentioned for the listeners are things that affect circulation. You don't really think about diabetes as being a vascular issue, but when you have diabetes, especially people that don't take care of it super well
Mhm.
or have spikes and troughs and things, you can have really bad circulation in your hands and feet. And that can leave you predisposed to this kind of thing. So, be cautious and watch your friends.
Definitely. So the next one on this list I thought was kind of interesting. I hadn't really thought about it. It says eye injuries.
Oh, interesting. No, I didn't think about that either.
I didn't either until I was reading through this article, which we posted a link on it on the notes. But you guys can go. It's got pictures and notes about that. But it was talking about freezing the corneas, eyelashes, snow blindness. I was like, huh, like I've never really thought about that.
Yeah, so snow blindness, I'm a little bit familiar with that. And it's sunburn on the eyes, but it basically like fills your eyes with lights. It can be really, really painful. It's hard to see. You see that with some noob skiers that go up to, Vail, some of the bigger mountains and ski for the first time, and they think, well, I'm not going to wear glasses. And they're so close to the sun. You have so much reflection off the snow, and it can be a huge issue for people. So really just being aware of that, wearing your sunglasses when you go out, especially in snowy environments, it's really, really important. And then you factor elevation into it. You're closer to the sun, you have less atmosphere protecting you. So there can be a bunch of issues with that. As far as treatment, I think it's really just covering the eye and removing them from that lighted environment. And I think most of the time it'll heal just fine on its own. I'm not super familiar with eye injuries and cold, to tell you the truth.
No, me either. Like, so I thought it was a pretty interesting article. Like, I was like, huh, like I never really thought about that. But kind of keep the eyes covered. We were always taught to cover both eyes, and like the more I've kind of researched that, the more I've looked at it, I'm like, I don't know. In the ideal situation, yeah, that covering both eyes is ideal. But if you've got someone that you're bringing down off the top of a ski and you're going to cover both their eyes up, like they're probably going to freak out on you. So if you can cover both eyes up, I would encourage it. But if they're going to freak out and lose their mind, then just cover up the one eye that's injured. But it kind of depends on the scenario. But just don't like hog tie them and force them down to cover up both their eyes.
Yeah, and so there's some different teachings now. Uh, Dr. Fisher posted a warning on one of my videos. I talked about eye injuries. And he like commented every time I see a comment, I go, "Oh no, what did I say?
Oh
What
no,
did I
what did
do?"
I do wrong?
So with that, there's some conflicting data on it because I was taught the same thing is cover, and the context I was taught about it was if you have like a penetrating injury or something in one eye, you cover that eye with an eye shield and then you cover the other eye because eyes move together. You can't move one eye and not the other one unless you're really messed up. And with that, Sloth from the Goonies. So with that, that was the initial thought, but now they've been finding that when your eyes are closed, you don't really control where your eyes go. They kind of roll around, you have that REM sleep cycles and things where your eyes just kind of move on their own because you're not looking at anything. If you have one eye open, it decreases that anxiety like you were talking about, and you can fix your gaze on something. So like, hey, don't move your eyes. It's kind of like laying somebody on your cot being like, hey, try not to move. That's in spinal precautions is they can fix their gaze on something, and it decreases anxiety because they know what's going on around them,
Mhm.
and go from there. So I don't know if it's officially been like taken out. Don't cover both eyes, but for me, that's not a priority anymore. I'd rather get that one eye covered up, and let them kind of see out the other one and just have them lock their gaze and say, hey, try not to move your eyes around.
Yeah, that makes sense because every time I've tried it, like the patient freaks out. Like I can't keep both eyes closed. So every time I've had some kind of like penetrating trauma to the eye, I've always just covered like one eye up because I never could get them to like be calm and like they're just stressing out more because I've got both their eyes covered. They're going down, we're walking them or getting to the ambulance, things like that. So I've always just kind of not done that. So just the one eye is covered is what I've been trying to do.
For sure. So we kind of talked about some of the gear earlier on. I think there's kind of levels of what you can carry. Were there any other conditions you wanted to cover?
No, I think about fractures too. Like we've been talking a lot about skiing and dislocation and stuff like that. So like for me in my winter kit, I would think about adding some splints or some ways to like some triangle bandages, stuff like that, some SAM splints, some aluminum splints, stuff like that, just for fractures. 'Cause I think you're gonna still see those even more in just like in the summertime. But um, that's kind of what I was thinking. And then people always seem to be concerned about heat with their first aid kit. Temperature, how does it affect my chest seals? How does the temperature affect my medicine? Stuff like that. So, what are your thoughts on like cold weather affecting your actual first aid supplies inside your vehicle?
Yeah, I think it depends what it is. Like, splint, gauze, quick clot, it's fine. Nothing's going to happen to it. It can sit wherever for however, like, obviously try to keep it from high heats. That's the big thing with like agents like quick clot. Um, but I'll be honest, I don't really pull my stuff like that out of my car or anything. I kind of let it be. When it comes to like anything that has adhesive on it, it has a pretty good temperature range, but when it gets cold, there's kind of a semi gelatinous material that can freeze. So it's going to become brittle and hard, and it's not going to stick as well as it would normally. It will probably return back to normal once the temperature regulates itself a little bit, but you do run the risk of it being an issue. And then when it comes to like medications, your aspirin, it's fine. Anything in a pill form is going to be fine. But the second you start talking about like liquid gels or saline irons, anything like that, that's where issues with cold are going to come in. So, if you're fine with it freezing, then thawing,
Mhm.
sure. But I think the best practice in the winter is just to have everything in kind of a convenient kit that you can bring right inside the door when you get home, and then just bring it right back out to your car when you leave, and not leaving things in the freezing cold for a prolonged period of time.
Definitely. I was just kind of thinking about the equipment too. Like when you were talking about stuff, like we know the hypothermia is a problem. So if you start putting on cold equipment like splints and stuff like that, like you could in theory make it worse for your hypothermia patients. So if you can keep them warm, is basically what we've talked about this entire episode is hypothermia, which is our big concern. So think about that. If you can carry a few extra hot packs, I probably would throw a few extra ones in there because knowing my luck, I'm going to pop one and one's going to go bad. So they don't take up a lot of space. They're super cheap. Uh, and even the instant hand warmers, you can put down your pockets, your mittens, and stuff like that. So I think if you think you have enough, I'd probably throw an extra couple packs in there.
Yeah, and don't I think in the civilian realm, there's a lot of momentum behind like tactical stop the bleed kits and stuff. Um, But with that, if you're a civilian, you can load your kit with a couple other things. Like you still want easy access to life-threatening things quickly, but you don't need a kit that's streamlined for a shooting situation, care under fire. Like that's much less common than having somebody break their arm in a car accident or, on the ski hill or something. So if you have some room and you can throw in some hot packs, some splinting things like you were talking about, those space blankets and some insulation in your car or something like that, I think it'll go a long way for you, because realistically, you're going to use that stuff a lot more than you're going to use that quick clot combat gauze for your junctional hemorrhage.
I agree. Completely side note, I scrolled off and was thinking about it. Were you able to zip your NAR4 bag on your last video that you did?
Yes, everybody was accusing me of all kinds of things. It's zipped no problem.
I watched the entire video. Like I was honestly because I have a NAR4 bag and I was just kind of curious of like how you laid out your NAR4 bag. So I was like, oh, I was bored. So I watched this prep medic video and then you folded it and I was like, I wonder if he can actually zip that.
And as crazy as it sounds, I want to get a smaller pack. The NAR4 aid bag is great, but I don't like that you can't see in the pockets. And I would like the layout to be a little bit different. I don't want everything to be in a pocket. So I'm looking for something smaller. Everybody keeps on recommending Tasmanian Tiger, but like it's not in the United States that much.
Yeah, like I had an M9 bag and I moved from the M9 bag to the NAR4 bag. So I thought the M9 was just a little bit too small for what I needed. Uh, but if you haven't watched that prep medic video, I would suggest you go watch it. You're talking about different tiers of your equipment, so I think it's a good, even for the civilian guys to go watch that because there's been a lot like in the beginning of like I would say like the beginning of all the prepper coolness, like to be a prepper. it was all like, gotta have a bug out bag, gotta get a get home bag. And now it seems like all the cool preppers are moving away from get home bag, going, look, that's dumb. Like we can't carry that much stuff in a get home bag, so I'm gonna have stuff in my truck. So it is different tiers, even on preparedness for that level. Like I have stuff on me, I have stuff in my truck, and then have stuff at my house. So I have different layers of preparedness even there. So I think for what you're building and what you're thinking about, that is relative to even our listeners as civilians to go watch that NAR4 video. So good job.
Thank you. Yeah,
I'm going to edit this out. No one's ever going to hear that anyway. So
yeah, you're buttering me up, right?
Yeah, like editor, can you please delete the last 5 minutes? Thank you.
Actually, anytime Sam talks, can you just get that out of this, please?
That'd be awesome.
Yeah.
No, I appreciate it.
Yeah, absolutely. I think one last thing with it is not falling into the trap of, cool guy expensiveness, which we all do I do on social media. You see somebody you admire post something, you're like, I need this piece of kit. I need this. We're here, I'm promoting, the Ready Heat, and I don't get any money for it. We're not sponsored, but you don't need the Ready Heat. A wool moving blanket and some hand warmers will do you just fine in most situations. So, don't feel like you have to spend $1 million to get this stuff. Start with your $2 space blanket, move up, get some hand warmers, get that blanket, tier it as best you can, but you don't have to spend $1 million.
But if Ready Heat wants to send us a few blankets, we would definitely take them, right?
Take any sponsors.
Yes.
Sell out for anybody.
Yes. If you'd like to sponsor the Civilian Medical Podcast, you can email me or don't email Sam because he won't tell me we got a sponsor. But we're definitely always looking for sponsors. We're just broke paramedics. So, and Sam has a baby, so he's definitely broke.
Absolutely.
Awesome. Anything else to add?
Nope, that's it.
Awesome. Well, we did get some of the comments from you guys talking about different show ideas. So we wrote those down. I think got some good ideas. So kind of worked through that, kind of playing with the future of the show. Talked about how we can do some things a little bit different. Maybe you can do some live podcasts for you guys. Like that'd be cool. So definitely think about the future, how we're going to do some different stuff, a little bit different. Definitely think we should do a t-shirt with Batman and Robin. So I'll get to working on that. But cool. Thank you guys for listening. You can go to medicalgearoutfitters.com to get some first aid gear and supplies. Use coupon code Civilian Medical to save 10%. And don't forget to go check out Prep Medic on his YouTube channel. He has a few subscribers that are lonely over there. So awesome. Thank you guys.